Hello and welcome to Health Professional Radio. I'm your host, Neal Howard. Our guest in studio today is Dr. Indra Cidambi, leading addiction expert and medical director at New Jersey's first licensed outpatient substance abuse detox facility, the Center for Network Therapy. And she's in studio today with us to give us some insight into some of the signs of addiction, how we can help, and especially when it comes to our teenagers who seem to be becoming hooked on drugs in an epidemic rate. How are you doing today, Dr. Cidambi?
Thank you.
Thank you. When it comes to drug abuse, what is it about this new so-called good grade pill that seems to have teenagers becoming hooked at an alarming rate?
This is the stimulants, Adderall mostly. Students think that they want to score well, and then they go for these Adderall and they want to abuse them because they think that they are going to have with success get good grades, but that's not what it's supposed to be doing. It only works on your working memory. It does not really give you, the rote memory is what it helps, and the working memory is what you need to get good academic performance done. So it doesn't help you with that at all.
So there's a misunderstanding about the way that the drug works in the first place, yeah?
Correct. They think, with Adderall I'm going to score well, because it's not supposed to be doing that. If it's only a rote memory, you're going to just memorize stuff, and you need a working memory to do well with to get high scores and obtain a good increase in concentration. But then this Adderall really does help you increase concentration, make you focus, and helps you stay up longer to study. But then the next day, one is going to crash from the Adderall, and so they're not performing well in the test. So it's a myth. It's a myth that it's an academic achievement steroid.
So once you become addicted, then you're not able to take advantage of what the drug was intended for, as far as your concentration and your rote memory. Now you're just addicted to the drug, and I guess struggling to maintain the addiction.
Correct. And, this research has shown that over 25% of teenagers believe prescription drugs can be used as a study aid. And they use it, non-medical use during college days for them to achieve more scores.
Well, let's talk about some of the signs that maybe a student or a loved one is hooked on some type of substance, whether it be, an opiate or a stimulant such as Adderall. What are some of the signs to look for?
What you see is, like, first of all, the behavior changes, the pattern, like they become very irritable, and you see the symptoms of anger, and they are not sleeping well, they are quite anxious, they have mood swings. When you see that, in general, we are talking about any addiction. And so that should raise concern for the family members if there is something that's going on. And then they become absent-minded, they're not engaging with us, and they're isolating themselves, and they have some psychological dependencies, and then they become quite anxious, and they kind of forego anything to obtain the drugs. And then you see that they've been lying, they've been stealing, and they're preoccupied within themselves. And they're falling off from all their activities, they don't go to school, the grades are coming down, and they are not keeping up with the relationship, and a lot of debts, financial constraints. So once a person starts seeing that, you should pay attention to something is going on. And so there is a disruption to the daily routine. That's most important. And you also see somebody snorting, you see that nasal, they have runny nose, and they have red eyes and stuff like that. That's very important for us. And you should also be paying attention to the paraphernalias. You would see in their rooms, cut off straws, or dollar bill rolls, and powder on the counter surface and stuff like that. So that should kind of alert you. And also, if you see spoon in the car, and if you see some aluminum foil on the floor, so rubber bands, it's kind of alerts you, and you should say, okay, I should first talk to my loved one and confront them with the thing and ask them point blank. First of all, ask them, don't jump to conclusion. Just ask them and understand their stresses, and tell them that you're here to help them. Obviously expect them to lie to you first. That's the nature of the beast. So they are going to deny, they are going to lie to you. But then once they understand that there is no way out, they have to come clean, and they will tell you 1/4 of the story, and that's good enough to take them to the next step of getting appropriate treatment.
Do you find in your experience that one age group or another is more receptive to your type of ambulatory detox as opposed to another?
Not at all. I've been seeing young kids to, kids is like anyone about 19 and above, and those from that age to age 80, they are all with an open mind when they come to ambulatory detox. As I said, it is more friendlier for them. It's not the fear of going away. So the struggle is the addicted population. They always think that my family does not want me, they're going to kick me out. That's the fear that they have.
Do you at the Center for Network Therapy treat patients differently depending on how their addiction came to be, whether they were trying to escape the stresses of their life and became addicted, or whether or not they had an injury and became addicted to some type of painkiller? Are there differences in your approach to therapy based on how their addiction came to be?
Not at all, because it doesn't matter. The brain doesn't understand how you obtain the opiate. It could be a doctor's prescription and you took it for pain and eventually became addicted to it. Or it could be heroin that you bought from the street, or the prescription pill that you bought from the street. So the reward system in the brain, it's all the same. You're getting the fix from outside. And having said that, it's all about stigma and shame associated with the drug use. So what I focus on with the patient is anybody who comes in with the addiction problem to us, I do not judge them, number one. I take away the shame and stigma out of the equation. I tell them your your addiction is an illness. It's as good as diabetes. So there is no difference between diabetes and your substance abuse. It kind of makes them go surprised, and they say, oh, isn't it my behavior? I brought it upon myself, and I should struggle to come off of this drug. And I tell them that's not your fault. You should take accountability. You should work towards sobriety, but that doesn't mean that it's all your behavior. Part of it is your behavior, but it is an illness. It's a brain disease. So that kind of takes away the shame and stigma, and that is the truth of the matter. Addiction is a brain disease. And once you do that, and then I tell them that there is no need to lie. You have to be brutally honest with the treaters. And that kind of gives them first step with us, and they understand by someone admitting to us that I relapsed, that's not a threat. And we come to sit down with them and ask them, why did you have a relapse? What you could have done differently to avoid having a relapse. So that kind of makes them understand the next time around they will not have a relapse, because you walk through this cycle of addiction.
Now, one final question, Dr. Cidambi. Before founding CNT, or the Center for Network Therapy, you were the Director of Detoxification and Rehab at Summit Oaks Hospital in Summit, New Jersey. Have you found that you are able to help patients more hands-on or in a more comprehensive way now that you are Medical Director at CNT as opposed to Summit Oaks?
I always was able to help patients at any place that I work with, but then Center for Network Therapy is a model that I put together by working inpatient. I did understand what the patients were missing out. It was a revolving door for them. That's because when someone got detox, they didn't have enough support to address the post-acute withdrawal symptoms. So what I did with Center for Network Therapy is to have detox and then down to partial hospital program, which will be 2 weeks after the detox. Detox goes from 9 a.m. to 7 p.m., during which time we also incorporate the family part to it, which was a missing piece in majority of the patient inpatient, because they wouldn't give you the release or the family is not coming in. We don't have so many family meetings, and in real life, what is going on with the patient and the family. So I get that piece at the Center for Network Therapy. So it kind of gives you a family with the patient, the whole picture. And also we work with AANA. They come in on a daily basis and they run the group. So instead of asking the patient, you should go to 12-step program, we incorporate that in our program. So it kind of comes as one big umbrella. You see the family part, the daily addiction treatment for detox, and then the partial hospital program to address that post-acute withdrawal. Because post-acute withdrawal can really make a patient come off of the detox level of care, go home, and immediately before they step down to intensive outpatient, which will be like 2-3 days later, their discharge time from the inpatient setting, they go unused because they don't have enough support. They don't understand. They went back to the same stresses that they left early from before going inpatient. So I kind of took everything that was not working in inpatient and coined all those things to make my ambulatory level of detox. So I kind of get the satisfaction that when a patient comes in, I'm able to give them everything that they need. So both myself and the patient enjoy this level of care.
Excellent. Excellent. You've been listening to Health Professional Radio. I'm your host, Neal Howard. We've been in studio talking with Dr. Indra Cidambi, recognized as a leading expert and pioneer in the field of addiction medicine. And she's been in studio this afternoon with us talking about some of the signs to look for in substance abuse, some of the ways that you can help, and also some of the ways that you can manage the stress and avoid some of the triggers. It's been great having you here with us today, Dr. Cidambi.
Thank you.
Thank you. Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm, and you can subscribe to our podcast on iTunes.